when you go into surgery with a fast, what we call NPO status, you get very dehydrated. That can affect your postoperative nausea. And we have some literature to show that. So a lot of the OR team, including the anesthesiologist, are incorporating more of that, fasting state. What does that consist of? Can we safely give them, clear fluid or an electrolyte balanced fluid that can be safely incorporated during their surgery so they're not dehydrated, for sure. So that's one of those factors that we're gaining more knowledge in.
Welcome to the Motion Lab, the podcast that explores the science of movement and helps you live a stronger and healthier life.
All right. Welcome back to the Motion Lab podcast. My name's Chuck Dowell. I'm one of the physician assistants here at Colorado Springs Orthopaedic Group. I'm here with Dr. Van Manen.
Dr. Van Manen, board certified orthopedic surgeon, getting ready to finish up my fellowship here at CSAUG.
Yeah, so your fellowship's ending soon. We hope that your schedule and you'll be seeing patients in your own.
Yeah, in July, fellowship ends in July. So that time we'll have the schedule out and block time out and start rolling.
So you remind me, you're native from this area?
Native from Pueblo.
Awesome.
Yeah, I grew up in Pueblo, Colorado.
Military?
Yep. Spent time in the military after residency, United States Navy.
Awesome. Mm-hmm. Still reserved or no?
Doing some reserve work, yep. Always on that low inactive reserve status in case something hits, always being available for our military.
Never know.
Yep.
So we thought a good topic would be fueling, we talked about nutrition in the last podcast from more of a athlete standpoint, but this is from more of a post-surgical, surgical standpoint. Mm-hmm. You do mostly total joint surgeries.
Yep.
And so we were talking off camera, which, we'll try to include in the episode, how a lot of patients come in and they always ask questions as to what can I do to make my outcome of my surgery better? And from a surgery standpoint, there's modifiable and non-modifiable things that they can do and or we can offer. Mm-hmm. The choice of the surgeon, is obviously one of the cases. They can't necessarily choose the hospital or the implants. It's often up to the surgeon or the facility they go to. But nutrition is definitely something that they can modify. And so generally, when you're talking to somebody that comes in from a pre-surgical standpoint for a joint replacement, what's your recommendations for them?
Yeah, I mean, it's, first and foremost, establishment of trust between the surgeon and the patient. So trying to get a feel of what the patient is looking for, what their functional deficits are. And then if we come to the conclusion that a total knee or a total hip replacement is going to become their treatment for their disease, their arthritis, then we kind of we set the standard for a protocol. And that starts with a preoperative optimization protocol, which is still very much highly debated on exactly how we can extrapolate certain protocols, certain non-modifiable factors they can control that will give them a better outcome.
Yeah.
So getting that and dialing that in is extremely important. And then streamlining it, like we were saying before, with proper communication and then proper resources that are evidence-based that the patient can then reliably go to.
Yeah.
Nutrition is definitely gaining more heat when it comes to replacement surgery. As far as exactly how that is incorporated is still, very much up to the surgeon and of course up to the patient and what they feel is something that, because ultimately we're consultants.
Yeah.
It's their body, their arthritis, their functional deficits. And of course, if decision is made to make a surgical decision, then we have to optimize them based on giving them the proper resources, proper information for them to be optimized for that surgery. 100%, I think it does absolutely show in the literature that those modifiable risk factors can be controlled and optimized, especially with diabetes or some of the risk factors that we do know can lead to a potential infection after surgery.
Yeah,
100%. How we do that is very, it's more of the philosophy of the doc and of course connecting with the philosophy of the patient so they have understanding there.
Yeah, and so that's the independent side. Each surgeon is going to have their own kind of idiosyncrasies of how they do
Practice
things.
Philosophy. Yep.
But as you said, patient education is important. So when somebody comes in to see you, you want to educate them appropriately on the expectations regarding the surgery itself, the kind of expectations of what I'm going to do before the surgery. I'm going to go see my primary care. I'm going to make sure all my health concerns are addressed. My laboratory tests are all, within good realms where the surgery is going to be successful. And then you're going to discuss with them, the hospital stay and the surgery itself. And then some surgeons will, and now kind of a growing topic, will discuss nutrition and the importance of it, because our body needs fuel. Surgery is a very stressful state, and your body goes into a stress response because of the surgery and everything revolved around it. Even the fasting for surgery is stressful, right?
Right. There's even more protocols now with anesthesia when it comes to the NPO status, that we're starting to incorporate electrolytes.
Yeah.
Kind of when those electrolytes can be incorporated, because we do know that when you go into surgery with a fast, what we call NPO status, you get very dehydrated. That can affect your postoperative nausea. And we have some literature to show that. So a lot of the team, the OR team, including the anesthesiologist, are incorporating more of that, fasting state. What does that consist of? Can we safely give them, clear fluid or an electrolyte balanced fluid that can be safely incorporated during their surgery so they're not dehydrated, for sure. So that's one of those factors that we're gaining more knowledge in.
And even their glycemic index, right? So the fasting is going to change your glycemic index.
Absolutely.
The stress of the surgery is going to change that. That's going to affect complications and wound healing, mobility afterwards.
Especially in diabetics.
Correct.
Being able to, we do know that we get a hemoglobin A1C prior to surgery, as to look at a factor that we can potentially optimize that does have some implications on infection risk, wound healing after surgery. But we are also looking at more of the academy, and more of the joint surgeons now are looking at how their blood sugar is managed, what their blood sugar is at the time of surgery. Not necessarily their hemoglobin A1C, but other factors when it comes to the week and even the day, what their sugars are looking at on a consistent basis, and then being able to manage those properly postoperatively, which goes into how we are addressing their preoperative, nutrition, and then how we address their postoperative nutrition. If they are diabetic and insulin dependent, how we can manage their insulin to keep it more low and stable during their wound healing process, which is the acute postoperative stage of surgery, for sure.
And even some non-insulin dependent diabetics will put them on insulin initially afterwards to get them better controlled, a more efficient management because of the stress of the surgery itself. We often see this even just outside of surgery. Some patients will come in and have acute pain, and their insulin or their glucose will go up. They'll have infections and their glucose will go up. Your body's response is that, and so we'll often want to control that. And from a post-surgical and pre-surgical standpoint, that's definitely
absolutely
the case.
I mean, I think even in the wellness and kind of the regenerative medicine that we're seeing now with some of the influencers, some of these docs that are in that realm even propose that everybody should be on maybe a continuous glucose monitoring, just to kind of see exactly how their body responds to certain stresses, and of course certain meals, just to optimize your own health, right? Even if you're a non-diabetic, that's still controversial on how that can come about. But of course, I mean, I think that is a huge part of the nutrition piece.
And it's a huge part in sports performance, which
huge.
Is, how your response is to athletic activities, and do you need more carbohydrates beforehand or not? And so we talked about the fasting state. So some people would recommend maybe a carbohydrate-enriched meal 24 hours prior to the surgery, because then maybe that will affect and or decrease your, fasting, insulin levels that you may have. But one of the big things is it's important to start your nutrition a week before surgery, not the day before.
100%. I mean, a lot of times, especially some of the high volume total joint surgeons, we have a 3 to 4 month book out rate. And when you have that kind of book out rate, when you first initiate the patient contact, patient comes to see you, and you initiate the fact we're going to treat you with a total hip or total knee. We have a good 3 to 4 months, most of us, if not, depending on cancellation schedules, to really work with that patient during that time frame, which is more than just a week. We can really help them dial in. They have to lose some weight. We can really work in that nutritional piece and consultation with them. And some practices and some docs will even incorporate a nutritionist or dietitian through their primary care. And then, of course, can you do that in a good total joint group, where we could bring in some of that valued resources into that total joint practice, so that patients that 3 to 4 months prior to the surgery can really have that. And the cool thing about that is we become part of their whole with their whole health and wellness, not just their knee replacement. That we can actually help them, quit other factors like smoking. We can help them quit smoking to get healthier. We can also help them with nutritional. We can then put them on a good plan that even after they get their joint, not necessarily for their joint replacement, that we can put them on a good, kind of kickstart for a better lifestyle with their total joint. And so that's very important.
Because that's the thought process of the total joint, right? We want them to maintain their activity levels. We want them to maintain their lifestyle. That's the reason we're doing the joint replacement.
We're getting them back to life, getting them more functional, but that entails these other factors.
Correct. If we can improve the nutrition with that, then after the surgery, they're just going to have a better lifestyle. And the habits that they build before the surgery will translate better after the surgery. It's hard to start a nutritious diet a day before surgery and maintain that afterwards. You're going to want to go back to your natural factors afterwards, even
natural habits and behaviors.
Correct. Yep. So if you can start that beforehand, and then you can give your body the appropriate fuel afterwards to recover, your recovery is going to be much better. You would agree?
100%. I think more of the data coming out with the modifiable risk factors, preoperative optimization, and then recovery when it comes to getting used to your total joint and getting that recovery, most like in a sports performance kind of environment, extrapolating some of that data and bringing it to post-operative recovery. The more we can incorporate those habits, those behavioral issues, and really improve those, 100% we can improve patients' outcomes. When it comes to recovery, because recovery is a drawn out process, and I tell patients recovery is staged. The first 6 weeks is overcoming the trauma of surgery, overcoming the hit to the system, the surgical dissection, and some of the things that are incorporated in putting the implant in. Recovering from that 6 weeks and getting the incision healed properly. At the same time, moving those ligaments and moving the tissue and getting those muscles stabilized again is part of that 6 weeks. After that, then it's more of the deconditioning you had with your arthritis before. We have to then retrain those muscles with the implant in and get you through the 6 months to a year so that you're still recovering and still adjusting to this new implant up to a year. And that's a year that we have with them, that we can really also incorporate some of these factors that we're starting to see does come into play when their recovery and their outcome, what they're looking for.
Yeah. And, protein's obviously probably a big one. We're all a little bit deficient in our protein intake, and our body uses protein as a main source of fuel. But you had mentioned deconditioning related to prior to surgery and after surgery. I mean, they're going to be not as active after surgery. That's going to cause some muscle loss.
Atrophy.
And the atrophy and the muscle loss will be there. It's probably more prominent in our older individuals than our younger individuals. They say, 7 days of limited use will cause a 10% atrophy in middle-aged
close
people,
to that.
15 to 20% in older patients. And one of the ways that we can combat that is appropriate protein intake after the surgery. And if they can't get it from their foods they're eating, we'll often recommend supplements like Boost supplements, Ensures, things like that to supplement the protein intake. Because I think what sometimes people don't understand is that their body's doesn't have the protein to use as fuel. It's going to use the muscle as fuel, and that's going to cause further atrophy. Correct?
Absolutely. I mean, protein is the main source to produce the enzymes, produce the healing rate, and some of the breakdown products. You got to have the protein along with the activity too.
Correct.
But yeah, protein is anytime you have a hit to the system, your metabolic rate goes up. The healing of your tissues and the use of those healing proteins has to be supplemented with protein intake, so you're not malnourished. And so that's kind of a common sense.
Yeah.
Right. I mean, if you're deficient, you're going to be more deficient after the surgery, right? Because you're going through a second hit when you have surgery. You may have been pretty deficient beforehand because of your lack of mobility, because of the arthritis and the pain. And then, of course, if they're not on a good if they were kind of poor nutritional to start with, some of the patients may have chronic disease. They just may not be eating the right foods, and they may be automatically deficient prior. Then we got to make sure that we build that up before and then maintain that afterwards.
Yeah.
And that's just being, cognizant on proper nutritional intake, which again, what do we recommend? Fruits and vegetables, paleo diet, Mediterranean diet, high carb diet, low calorie diet. Like, one of the things we have to worry about too is when we put patients on a weight loss, try to optimize their BMI, we got to make sure we're not making these patients malnourished. Yeah. Right. And so that's very tricky. That's why resources like a dietitian or, your surgeon being up on that type of literature and expertise can help guide that. But yeah, protein, I mean, across the board, I think protein should be incorporated, in any recovery, depending on the source of protein. That's, depending on what the patient what works for them. If it's a supplement, protein shake, plus just good protein from good
Right.
whole food products.
Yeah. Yeah, I mean that's the hard part is it's there's so many different influencers and different commercials and things like that out there. It's kind of hard to decipher through it. So
Yep.
sometimes that's where you go to a dietitian, you go to
Yep.
a nutritionist, you go to
Sure.
your surgeon, you go to primary care, and you see if they can kind of give you recommendations or guidance regarding that. But I mean, we all have kind of the same recommendations. When you go to the supermarket, shop on the outside, not in the inside of the supermarket, because the outside is going to have most of your nutritious stuff.
Right. I mean, I think, talking about nutrition, which is still very controversial in medicine, is a lot of people will put out, calorie dense foods,
Yeah.
right? I mean, if you look at certain foods, they may, they're calorie dense, but they're easy to eat, chips, potato chips, processed foods. Again, when it comes to that whole subject on weight loss, maximizing, body mass index, making sure you're not, so malnourished that you're eating up skeletal muscle, because sarcopenia is also a malnourished state. I mean, you don't want to have that type of malnourishment before you have a joint replacement.
Yeah.
You want to have maximized muscle. You want to be as healthy as you can based on muscle body fat index, right? You don't want to lose too much weight. But when it comes to understanding what to eat and how to eat it, it's, there's all kinds of different ways of doing that. But I would say yes. I would say whole natural foods is probably a common sense,
Yeah.
right? As opposed to too much of the calorie dense type of foods or the processed foods.
Correct.
Right.
Because those processed foods or the complex carbohydrates are going to be more inflammatory as well. And
I think so.
Surgery is a huge inflammatory condition. So that inflammatory state after surgery will affect their ability and mobility afterwards, because they won't want to get up and move because their joints hurt.
Right.
And so those low inflammatory diets potentially will help recover afterwards as well, will reduce the inflammation, improve wound healing, all
and that's
that
still
stuff.
very controversial. What kind of foods will set up a pro-inflammatory state in that individual? What foods may be a lower inflammatory state in that individual? There's a lot of different complexities there, and it's really hard to study. I think a good common recommendation would be, a well-balanced carbohydrate, protein, diet, fats as well, good healthy fats, but really kind of looking at the whole foods, right? Looking at really good whole food management as opposed to fast foods, as opposed to, overly, especially sugar, right? Simple sugars, high fructose corn syrup, and some of these really good dopamine enriched foods that people just tend to overeat.
Yeah.
Right? I mean, you should look for really good foods that will fill you up, give you that satiety, and then be able to maintain just a good overall healthy nutritional intake, supplemented with, maybe a morning multivitamin to make sure you're getting all your those macronutrients. There's micronutrients. Looking at some of those micronutrients that do help with maybe surgical healing of the wound.
Yeah.
Right. And some of those, like L-arginine, has been shown in some of the papers to help with wound healing.
Yep.
Right. Because it produces nitric oxide that can produce more blood, to the healing tissue and maybe get that scar to heal a little bit quicker and nicer. So there's different things that you can look at as well, supplements as well. But yeah, overall, I mean, I think, it's a good, well-balanced, whole food, not processed food, and keep your sugars. Just keep that sugar content down, right?
As best you can. Yeah.
As best you can, right? And I try to do something more complex with your carbohydrates as opposed to some of the simple high sugar foods, and that's what we all like. We all eat it. Right?
Yeah.
Ice cream after dinner is a staple for most Americans.
Yeah.
Especially if you have kids.
Yeah.
The kids are going to have an ice cream cone. I'm going to have one too.
It's hard to resist, right? My kids are like, I'm going to go get an ice cream. Do you want one? I'm like, yeah, I'll take one too.
Absolutely. And of course they want to go to crumble cookie at 7:30 or 9:30 at night after studying. It's like, why don't you get dad something?
Yeah.
But yeah, it's hard, but it's a balance and it's a complexity of everything, trying to well package that patient to be conditioned as best they can and optimize, which is physical activity, it's supplements, it's nutrition, it's proper communication, and then being able to dial that in for them as simple as we can. Because everyone comes to us with a little bit different in their health literacy.
It's going to be individualized.
And now information is coming at us
Yeah.
all over the place with social media, YouTube, podcasts,
Mhm.
with different influencers recommending different things. And it's really hard to sift through exactly what would be good for me,
Mhm.
as far as that nutritional recommendation. Yeah,
And it's the same with supplements as well,
it
because
is.
there's a lot of supplements out there. There's a lot of advertisements out there. Hey, take this, take that. It's going to make you fitter. It's going to make you leaner. It's going to make you stronger. It's going to make you heal better. Things like that. I mean, it's hard to decipher through that.
Mhm.
I think in general, we try to recommend the things that have the longest, research or back record to them. We know vitamin D traditionally is
Right.
pretty helpful.
Right. Own the bone and orthopedics, vitamin D,
Yep.
and using vitamin K2 to help with that absorption. Right. I mean,
Yep.
that's a very common thing that we've proven over the years. So, yeah,
Because bone is huge, especially in a joint replacement aspect. When you go in there,
the bone is supporting the implant.
correct.
Yep.
And oftentimes we require that bone to grow into the implant to allow the
100%.
implant to stabilize. And so if they have good structural bone, that can be helpful. So vitamin D, and then as you said, omegas, fish oils are always kind of healthy for a lot of patients to have for multiple reasons.
Right.
And calcium is on and off. It depends on if you come in with a previous history of osteopenia or osteoporosis.
Exactly.
So you'd want to discuss that with your doctor or kind of a bone health
Especially in
specialist.
our older patients that are prone to osteoporosis, I think that's a very key point for any orthopedic practice, is to have some expertise in bone health.
Yeah.
And that's part of the nutritional component, right? Because
Mhm.
bone health is very closely tied into nutrition.
Yeah.
It's also closely tied into weight bearing,
Mhm.
joint loading exercises. And we have a ton of people in their later years, especially in the female side, that get osteoporosis. That can affect your surgery. I mean, we have techniques, and we don't have any literature to show that if you're osteoporotic or osteopenic, you're going to have a higher risk of failure of your implants. But common sense is, why not maximize your bone health prior to any surgery?
Mhm.
And then the other thing with orthopedics is fall risk.
Mhm.
More patients are coming up with geriatric fractures. And the biggest thing in total joint replacement world now is periprosthetic fractures,
Yep.
right? And you get a joint replaced, and then you have more of a fall risk later on, 5-10 years after your joint replacement. You're older, you're a little bit more unsteady on your feet with balance. And if you're osteoporotic, then you may be more predisposed to have a periprosthetic fracture, which is a fracture around the implant, which are challenging cases.
Mhm.
They're very debilitating for patients, and they're challenging cases for surgeons. And they're time consuming. The rehab is harder, especially around an implant if they have a fracture. So a lot of that stuff does kind of, in this whole umbrella of nutrition, bone health is critical, and bone health is directly tied to proper nutrition.
Yeah.
Yeah, and physical activity, right?
Yeah, because we know when we load the bones kind of, are able to
Mhm.
become stronger just from, the natural processes
Yep.
of it. And so, and sometimes that's hard. We have a lot of patients that come in, from a weight standpoint, nutrition standpoint, and say, my knee hurts or my hip hurts. I can't walk, so I can't be active. So therefore, it's hard for me to maintain a healthy lifestyle. And they're, definitely true. It's hard to be as active, but diet is something that's still controllable in those
Still
situations.
controllable.
And that's something that they can still kind of dial in and try to keep as efficient or healthy as possible to then allow better recovery afterwards.
100%. And that's probably one of the biggest things we see, is that patients have a very destructive arthritic joint. And they've been dealing with it long. A lot of patients will put that off prior to making the commitment to see an orthopedic surgeon.
Mhm.
Where they just deal with the pain. They're very reluctant to have any type of surgical procedure. And so when they finally get to that point where their daily activity is so severely compromised, they finally wave the white flag and they're here seeing us.
Yeah.
A lot of times they'll say, well, over the last year, I've put on weight. Over the
Mhm.
last year, it's been progressively harder to stay active and physically active. And those are challenging. That's a challenging scenario
Yep.
to pre-optimize those patients, right? And it does take, it's not just, we can't just do it with a visit, right? We have to have the associated resources to be able to help that patient and guide them prior to their surgery. But you have to be creative, right? And that's when you have to kind of you have to come at them with a Swiss Army knife type of approach.
Yeah.
When it comes to working with them on what could potentially modify activity to keep their joint mobile, to keep their bones healthy, and to keep their nutrition stabilized.
Mhm.
And that's, part of the whole optimization, incorporating that nutritional piece when it comes to trying to balance out calories in, calories out,
Mhm.
their metabolic rate, right? It's simple. It's really calories in, calories out, and the proper calories have to be coming from the proper nutrients.
Yeah.
I mean, it's this overly simplified. That's kind of where I want to stay, is because getting too dogmatic in a specific program or a specific diet. We just don't have the literature to prove either one.
Yeah.
So we have to try to keep it simplistic for folks and kind of give them the big picture and let them dial in for themselves what will work for them as far as what they can eat, what nutrients they need to incorporate that for bone health, skeletal muscle health, and of course that proper nutrition for wound healing afterwards to maximize their, so their wounds are healed.
Which can be a huge complication.
Wound healing is
a huge
still
effect on the patient.
It's still a very, very high factor, when it comes to the total joint infection. Post-operative wounds are still highest of importance. We got to get that wound closed over the joint. The faster we get that wound closed over the joint, less of the environment can get into that joint. So that wound has to be closed. And that is the indirect effect of proper nutrition, right? Good surgical technique, right? But also proper nutrition leading up to that. So they can dial in that wound healing as best they can.
Yeah.
And again, how do you do that? What nutrients, what is this? Is very hard to decipher through the literature. That's why it's keeping that kind of, just making sure we guide them on a overall predictive path for them, keeping it as simple as we can. And then they can do their own research and resources. And then using other people like family practice docs, dietitians, to personalize that for them. Yeah.
It's definitely a multidisciplinary,
Very much
individualized approach, which I think a lot of patients need to realize. You're going to come in and see you. You're going to be the surgeon. You're going to do the surgery for them. But there's a lot of things that are going to play into it. The physical therapy afterwards and the physical therapist, their dietitian or primary care, their spouse or loved one kind of helping them on this, healthy habit diet. All that stuff is going to definitely play into it, and everybody has to be a part of it. And as you said, I think importantly, they need to change those habits prior to the surgery itself. If you have a 3-month waiting list and their surgery is not booked for 3 months from now, start those changes now. So then they're more easily to follow after the surgery as well. And you don't fall back into bad habits just because of maybe the mental component after the surgery because of the struggle of the recovery.
Absolutely. I mean, I think as soon as we can get them optimized and starting on that, because a lot of poor nutrition or malnutrition or the obesity epidemic is behavioral, and that's what a lot of the influencers and the doctors that are trying to address chronic disease, right, metabolic disease, and trying to address some of these factors that are associated with it. It's tough to really just keep it binary or keep it just unilaterally stuck on what to eat, how to eat it, and the exercise. You got to look deeper. It's a behavioral thing, a lifestyle thing, and you don't do that overnight, right? None of us are perfect. Everyone has habits, certain addictions, certain things that, maybe I shouldn't be doing this, but you do it. And that's a behavioral thing. And that's a very deep ingrained psychological thing. And that's very hard, right? That's very hard to just change overnight, especially when it comes to optimization for an upcoming surgery that's very stressful. As well. They're going to be handling the stress, the unknown. They're going to be out there in the community asking friends and families, how was your experience? How was your joint replacement? How did you recovery? And again, going back to the experience, that's what patients want. They want a good experience. Most importantly, they want a good outcome.
Yeah.
They want to get back to what they can't do because of their destroyed joint. So that's a very important thing, is giving that experience, because that'll help. That a good experience will give them motivation to then change the behaviors and work on some of the things they got to work on. Because there's very much a patient factor when it comes to a good, successful outcome with your joint. Then there's a surgeon factor, right? And we look at that in the literature all the time. What are the patient factors? What are the patient selection factors? And then what's the surgical expertise factors?
Yeah.
And that all comes into play for the overall outcome.
Yeah. So, I mean, in general, what we've talked about a lot of things, but I think the general synopsis of everything is, number one, every patient's a very individualized approach. I think it's important to have a healthy diet. There's a lot of different recommendations, as you mentioned, as far as dietary, what to use, how much protein to take. And it's outside the realms of this podcast for us to recommend those. But in general, let's eat healthy foods, fruits and vegetables, good protein. Try to stay to that outside aspect of the store, stay away from those, refined sugars and things like that.
Yeah, I mean, we see a lot of, the big thing is we see a lot of, diabetes is a big thing we have to contend with. We do know diabetes does potentially increase the infection risk, because there are a lot of different
For sure.
philosophies and discussions on how to optimize diabetics. It's just really good glucose management,
Yeah.
really good blood sugar management. The sooner you can do that before your surgery, and the better you have the ability to do that after surgery, is important. It's not just the A1C. It's not just the A1C. Say like your A1C is a good 6.9, it's well managed. We get it, a couple weeks or a month before the surgery. It meets our cutoff or our criteria based on the surgeon's preferences. But then when that patient comes out, the stress and of course the nutrition afterwards, starting from PACU,
Yeah.
all the way through their recovery, and if they go home the same day or if they stay at the hospital, if we monitor their blood sugars and we're seeing 200s and 240s and 250s, that as a surgeon, for me, that kind of I cringe at that, because then that means during their prime healing state, okay, when they're really at that high risk of infection right after surgery, that's what we got to really work. So I would say a good synopsis of this discussion is really working on sugars.
Yeah.
Right. Making sure that you really work, because that's kind of where we can tie in the infection risk is the blood sugar management. So that's what we can really work in, is dial with nutrition. Again, that goes back to the resources with the dietitian as well as our primary care. Yep.
And possibly using that continuous glucose monitoring, even if you're not diabetic, just to see what those natural sugars
absolutely
are.
It's worth something to look into, if that's something we could potentially use for patient care post-operatively. Again, it all comes down to resource management and how we use it, right? And then how we use it on an effective model that's going to improve outcomes. And then of course, we're always in state of medicine now, we're always worried about cost.
Yeah.
Right. And who's going to pay for it? But yeah, I think keeping it simple with nutrition is pretty much my approach, but also being diligent on the accountability with that.
Yeah.
And making sure they understand the importance of that.
Yeah, because that's something that they can take control over. Patients always want to know what they can control to affect their recovery afterwards, and nutrition is definitely a component of that. And if they can start that beforehand, maintain that through the surgery. Now, we will say, incidentally, we'll have them stop their supplements 5 to 7 days beforehand because of potential bleeding risk.
Right, and that's a controversial subject because I think it's it's kind of it's more efficient just to give them an all-out handout and say, what. Stop them all.
Yeah, stop everything. Yeah.
Right, and so because it takes a lot of resources to kind of look at every individual supplement, what that supplement may do to a bleeding risk standpoint, and then being able to take them off that supplement. I think it would be nice and behoove the surgeon or the team to be a little bit more refined there.
Yeah.
Right, and that's something we can always look at. As far as what specific supplement we probably should, as opposed to just a kind of a hammer and a nail thing. Like, nope. You're taking 10 supplements, we want you off all 10. But then make it confused, and the patient gets off their vitamin D when they should be on their vitamin D. So
that's a hard one. But definitely that's part of the preoperative management where we could potentially go through those and individualize that for the patient.
Yep.
And then, discuss the nutrition and have that conversation with your surgeon about if you have any concerns regarding the nutrition and if they have any general recommendations.
Exactly. And I think some of the, some of what we're doing too in the total joint world is incorporating labs that could potentially help us with identifying. Now, how we use those labs and how reliable those labs are is still a little bit more of controversy. But getting a pre-albumin, getting an albumin, looking at their hemoglobin, right? We always look at their hemoglobin and their hematocrit to make sure they have a good blood volume. But looking at stuff like albumin, and then how do we optimize their albumin? When do we test for their albumin or the pre-transferrin or pre-albumin? There's different labs. You can there's different algorithms and there's different stuff you can look in the literature that can kind of help you with identifying malnutrition. But a lot of it is just, understanding the patient, getting to know the patient, spending time with them in the initial visit, and being able to see, okay, this patient probably, has some factors that we can modify. Yeah. And part of that in the nutrition factors is also smoking, right? Yeah. It's a good opportunity for orthopedic surgeons to really work on helping patients with smoking, right?
Because that's a huge factor that affects a lot of the things we've talked about: wound healing, complications, infection risk, and things like that, for sure.
Right. Now, trying to pinpoint exactly where the risk is tough to navigate through the literature.
Yeah.
But again, it's a lot of complexities.
Yeah.
And so it just makes common sense that if you're going to have this life-changing event, we're going to do the surgery that does have some, complications, infection being number one of them, which ties into, some of this discussion, is optimizing on all counts, right? Get rid of some things that we know common sense probably isn't good for you.
Yeah.
If you're going to recover from surgery. Like treat it like an athlete, right? Treat it like, a professional athlete that's coming to you for guidance on how to recover from an injury, right? Or they're going to seek out a sports performance coach to say, how do I get better, right? You should have that approach when it comes to your own body going through a surgery like this. How do I maintain the best option or opportunity for my body to heal from this?
Yeah, if there are controllable risk factors, then take control of those.
Take
and
control.
Try to modify them.
Take responsibility. Patient responsibility is part of the equation.
Well, we appreciate you, talking on the Motion Lab podcast. So just as a reminder, your schedule, we think you're going to be...
Yeah, so fellowship is coming up, ending soon. So end of July, and then we're going to start putting everything together and, start the practice.
And if they want to get a hold of you, call and ask for Dr. Van Manen.
Absolutely.
Okay. We'll put hopefully the link at the bottom of the screen somewhere down here. I don't know. Here. Who knows? Anything else you'd like to add? I think a good topic, a good discussion.
It's a great topic. I think this topic is something that we need to pay more attention to and get more dialed in. And, as far as, science, the practice of medicine is just that, right?
Yeah.
It's a practice. We're constantly evolving. We're constantly trying to be better for our patients. And then we also want our patients to be better for themselves.
Yeah.
And so having a good overall, umbrella for them to come and get healthier and not just get their joint, I think is an important factor when it comes to total joint arthroplasty.
Definitely. All right. Well, I appreciate you.
Right on.
Have a good rest of your day.
Yep.
All right.